guys who've used drugs and alcohol for many years and become entrenched in its use of those products. So it's our job to try and get some changes and behaviour changes, and so they can understand life is very possible without drugs and alcohol. They can have great times without drugs and alcohol and go forward.
During the assessment process, I would aim to establish a number of things. Firstly, I'd be looking at the chronology of their presenting issues and their problems, and trying to establish the relationship, if any, between those problems. I'd also be looking at whether the issues and the problems require independent treatment, or whether treating one will help alleviate the other. It's also important for me to get a more holistic picture of the client by looking at their lifestyle and any historical factors relating to their problems. It's this information that will lead to a practical care plan or an individual care plan that recognises their immediate needs and their long-term needs and also their wishes.
Of course, there will be trepidation and fear, what's going to happen, but in my experience, that was washed away by the welcome I got by the fellow peers, and in terms of the challenging groups, or having to look at our own characters and behaviours. Again, this is the best place to do something like that. It's safe. Safest place on earth.
We use dual diagnosis as a term to describe individuals who present with both a severe mental illness and problematic substance use. However, at Kenward Trust, we generally find that our clients' needs are often multiple rather than dual, and can include social, physical, psychological, as well as medical needs.
In the mornings from 9 to 1, it's the main crux of our work and the main chance of guys making differences in their lives. That's a therapeutic group.
Some of it's challenging, some of it was more straightforward, how not to pick up again. Again, nothing, it doesn't sound complicated, but there's all sorts of things we have to be taught how to look out for. Other issues, anger, loneliness, all the things that could lead us back to where we came from.
And in the afternoons, we're much more likely to do some activities as opposed to therapy type work.
You would have woodwork, you'd have education sessions, you'd have gardening, you will have repairing bikes, looking at employment skills for employment, all different things in the afternoon that probably wouldn't be touched in the life they were leading before they arrived here at Kenward.
So it's not all therapy and deep and meaningful. We do have fun here as well. It's a fun site. 20 blokes, it can be very funny.
This is a creative arts room. The residents come in here if they're going to paint or use the clay. Sometimes they're just in here and they're writing, so it's called creative writing. Anything creative that they do in here. If you watch the pleasure they get from doing something that they wouldn't usually be doing somewhere else, to see that it has a therapeutic value without question. And sometimes residents have never done anything like this and think they're not going to enjoy it, and once the process starts, actually they take off and you find actually they're fantastic at art, just hidden talents in there that they didn't know they had.
So we've got quite a few acres here, and the guys come up and you can see they've been planting. Well, we understand it's not for everybody, you have to have an interest, but for us it represents something. From very small things, very small tiny seeds, we get some really great plants, and I think it's a bit like the clients here. With time and a bit of nurturing and a bit of care, and they will get growth. It makes them smile. You've achieved something.
Because I'd never done any, I didn't see what people saw in it, but when I stood back and looked at the garden after it had been done, weeded, and it was looking pretty, yeah, there's a certain sense of satisfaction.